Assalamu alaikum. Today we are going to discuss literature synthesis, which is part of literature management. Research starts with a research problem. If the problem is researchable, then we make research questions out of it. For example, in the first problem, I made this question: what is the effect of streptokinase in treatment of complicated parapneumonic effusion and empyema in patients? For another problem on improving patient outcome, I was interested to assess the role of enhanced recovery after surgery protocols in improving outcomes for patients undergoing complex GI surgeries. And the third question is, what are the most effective strategies to minimize surgical site infections in abdominal surgeries, focusing on novel antimicrobial interventions and their impact on patient outcomes? So in this way, there were three problems and three questions were formulated. And for this, how can I get answer to these questions? The first thing is the evidence from literature. Literature can be published or unpublished. Unpublished literature is called gray literature. So when I search for evidence, evidence means research finding. I search for evidence, and if I get sufficient, adequate, comprehensive, and quality evidence for these questions, and the answer, I am satisfied with the answer, then there is no need to do original research. But if there is a gap in evidence, there are multiple type of research gaps. If there is a gap in research or answering these specific questions, then I will go for my original research. I can draft a research proposal and start doing research. Now we start with the literature analysis and synthesis. Number one step is to dissect the evidence using the literature review framework that we are going to discuss in subsequent slides. Second step is to list the central claims and or central arguments. The third step is to identify similar claims. And the fourth step is to identify the dissimilar claims. And the fifth step is to write a brief conclusion about it. This is the literature review framework, which is used to dissect the paper. For example, I have a citation of a paper here, a second citation over here, and I can read that paper and identify the research question or the objective of the study and write it over here. I can identify the central claims of the findings, and then I can write the central claim or the central main result or primary findings of the paper. And then I can look into whether a theoretical perspective or conceptual framework is being used or not. And if not given, I can write it over here. And then I will check for the rigor of data collection. If there is a rigor, then I can write yes, or I can write the details as well, which I will be giving in subsequent examples. And rigor of data analysis, that is also very important, whether the analysis was sound and relevant or according to the need of the objectives or need of the paper. And then relevance to the research topic. If it's relevant to my research topic, I will write it highly relevant and I can specify why it is relevant. So let's dive into one example. That is a paper published in 2021, Effectiveness of a Hand Hygiene Training Intervention in Improving Knowledge and Compliance Rate Among Healthcare Workers in a Respiratory Disease Hospital. So in this, you can see there are all these 6 columns, they are filled. For example, the research question was to evaluate the effectiveness of a structured hand hygiene training program on compliance and knowledge among healthcare workers. And the central claims in the finding were training improved compliance from 66% to 88.3%, and knowledge scores from 68.6% to 78.9%. So they are claiming a change in knowledge, a change in skills. And there was a theoretical perspective based on WHO's My 5 Moments of Hand Hygiene framework. That is the basic theory or the conceptual framework behind it. The rigor of data collection, pre and post training assessments with standardized tools were done. That was because the tools were standardized. So it means there was a rigor of data collection. And before and after assessment was done. And rigor of data analysis, statistical analysis demonstrating significant improvements and appropriate statistical tests were applied. And relevance to my research topic, yeah, it directly support my claims, and these claims I will be discussing in subsequent slides. So you can make a right whether they are supporting this paper is supporting which claim, but usually the claims are written after dissecting the paper. Then in the next, we have a paper on effectiveness of a hospital-wide program to improve compliance with hand hygiene. It is published in Lancet. Again, I have dissected the paper for you. You can see there is a third example, effectiveness of a simulation-based hand hygiene training in medical students. And it is Journal of Hospital Infection in which it is published. And the question is, does simulation-based training improve hand hygiene techniques among medical students? And the same way it is dissected. You can see this, we can make a table, or we can identify all the claims and put them on the left side, and then make a table with all the studies as the on the column top, and then we can see which study supports which claim. One study might support more than one claims. A better example can be of this review question. What are the teaching techniques appropriate for imparting theory and skills of hand hygiene to healthcare students? If this was my review question, then we can see how if I searched literature, I found 6 studies very relevant. And these 6 studies were making 3 claims. These 3 were common claims. And in claim 1, multimodal strategies enhance compliance for hand hygiene. And a study of Pittet, Erasmus, and Abood, and also the Kalsikova. These 4 studies, they support the claim 1, while there are 4 studies which support the claim 2, and claim 2 is simulation based training improves the skill, and claim 3 is role modeling reinforces theoretical concept. This is also supported by 4 studies. So there are studies which are making 2 claims at a time. Now coming to literature synthesis or summarizing the claims, you can see the claim 1 with all the studies supporting the claim, and claim 2 supporting studies, then claim 3 supporting studies. So in this way, we actually we do the homework for literature review writing. So before writing the literature review, this is the homework that we are going to complete, and then we are going to start the write-up. Now, how to write it? Central claim across the study, number 1 claim was multimodal strategies improve compliance. And this is the synthesized paragraph that multiple studies consistently report that bundled interventions combining education, visual reminders, easy access to hand rubs, feedback mechanisms, and leadership support are more effective than single component strategies. And this is supported by studies by Pittet, Erasmus, Randall. So they all are supporting it. We can also comment on the implications of this finding. That is, the teaching should emphasize system-wide support for hand hygiene, not just individual behavior. So this can be implication that can be used in the discussion portion of your manuscript. The second common claim was educational intervention enhance knowledge and skills, and the sentences or paragraph that we synthesized, many studies underscores that education and training, particularly those with experiential or interactive component, lead to improved knowledge, attitude, and compliance. So this is based on the citation from the evidence from these 2 studies. Implications are incorporate simulation-based learning and structured instructional design in hand hygiene training program. So it can enhance this simulation-based learning can enhance. So that's why the implication is to incorporate it. So the third common claim was role modeling and culture shape behavior. Observed behavior of senior staff and institutional norms significantly influence hand hygiene practices. This was another common claim supported by these 2 studies. And the implication is teaching intervention must also address hidden curriculum and promote positive role modeling in clinical setting. So you can see how implications they are driven by the common claims. Each claim gives us some specific implication. Okay. So this is an uncommon claim. Theory practice integration is often lacking. This study uniquely emphasized that theoretical knowledge alone does not translate into compliant behavior unless reinforced by clinical role modeling and practice opportunities. So the educational insight in this is embedding reflective practice and mentorship can help bridge the theory practice gap in hand hygiene. So this is uncommon because this claim was not made by other studies out of those 6 studies. Okay. The another uncommon claim was simulation as both teaching and assessment tool. While other studies included observation or training, this study specifically validated simulation as a tool not only for skill training, but also for performance assessment in hand hygiene. So simulation can be designed to include feedback loops, making it a powerful tool for both formative and summative assessment. So in that way, you can see what kind of this uncommon theme, what kind of information this uncommon theme is giving, and you can identify what implications or educational interventions or change in educational initiatives can be done according to that uncommon claim. So uncommon claims are equally important like that of common claims. There is third uncommon claim about cultural and institutional barrier in these studies that says that the systematic review highlighted that workload, glove use misconceptions, and lack of time remain barrier to compliance even after training. So policy insight, because this was a systematic review and it gave a policy insight, and these points are also related to the policy. Institutional reforms are required to address workflow constraints because all these three are workflow constraints, suggesting that teaching alone is insufficient unless structural issues are resolved. So this is an important uncommon theme that need to be addressed. So while it's in analyzing the literature and synthesizing the evidence for our literature review, we found many implications as well. So the conclusion we can make on this study is the reviewed literature reinforces the notion that effective hand hygiene teaching requires a multifaceted, system-based approach. While knowledge and skills training are essential, they must be embedded in a culture that values infection control, encourages role modeling, and mitigates structural barriers. All these points are evidence informed. They have their basis in the last 6 papers that we have discussed. Future educational interventions should integrate simulation, mentorship, and institutional support mechanisms to ensure sustainable behavior change. So here, when we make a write-up, this is an example of a paper. Adequate use of personal protective equipment is of paramount importance to ensure healthcare workers' safety and to avoid shortages of such equipment in the context of corona disease pandemic. This was a paper published a few years back, and in this sentence you can see they are citing two references, 1 and 2, because they have synthesized this literature and into a paragraph or into a sentence using these two papers in the background. And again, you can see 3, 4, and 5, 3 studies. This sentence covers 3 studies. The evidence, the information given in this sentence is covered by this, backed by 3 studies. Pre-hospital personnel is particularly at risk of contamination as they usually work in a challenging environment and have to stay next to their patients in the narrow space of the ambulance for extended period of time. So they are all more at risk, and this risk is further increased when high risk procedures such as endotracheal intubation have to be performed. So basically they are identifying in these 2 sentences all the personnel or healthcare staff members who are more at risk. So this evidence is from 6, 7, and 8, 3 studies. Again, they are using multiple studies to present it in front of us. So this is the way how we want you to be able to present your literature synthesis. So this is the example of synthesizing literature. And if we look at the overall structure of literature review, when you write the section of literature review in your thesis or as part of your manuscript, we start with the research topic, we go to the specialist sub area, then relevant primary research, and then our research question. So it goes like that, inverted funnel kind of way of writing. There are different structuring approaches to literature review. When you write a literature review of 1.5 page, 2 pages, or maybe in thesis you have to write 8, 10 pages, you can use different approaches or a mixture of 2 or more approaches. Like logical approach shows the development over time in ascending or descending order. That approach can be used when we are doing a thematic approach. We can use chronological approach within the thematic approach. Thematic approach is the most commonest approach that is used. For example, if I'm doing research on MDR-TB, I start with the definition of tuberculosis, the guidelines available for tuberculosis, the incidence and prevalence of MDR, drug-resistant TB, in which MDR, RR resistance, pre-XDR, XDR. So I'm going thematic in a thematic approach, using the thematic approach theme-wise. And in each theme, I can use chronological approach, I can use methodological approach. And methodological approach is in which you tell the methodology. For example, a systematic review was conducted in a specific area, in a specific place, on these studies, on this, with this review question, which shows this evidence. So you are using methodological approach, starting with a systematic review, going to an RCT, then going to or meta-analysis, and then RCT, and then going to observational studies. In that way, either you can use methodological approach within the thematic approach, or separately as a methodological approach as well. So there is fourth approach, that is theoretical approach. Theoretical approach, it gives the theories the underlying the claims, or you can say that if there are different school of thoughts that you want to explain, then you can use theoretical approach within the thematic approach, or you can use theoretical approach separately. Uh, uh, that will give a boost to your literature review synthesis. So theoretical approach is usually used in qualitative research, but in quantitative research, it also has a big value, or you can say it's important to give theoretical approach as well. So you can go to John Hopkins University site, and where you can see how to summarize, how to write a literature review, again evaluating the literature, summarizing the literature, synthesizing and integrating it. So you can have hands-on, or you can go through that material as well. If you look for AI tools for literature writing, literature review, or writing discussion, we have SciSpace, that is the unpaid or free portion is also it's good, and you can get almost 10 papers at a time analyzed, and there are so many things that you can learn while using the SciSpace, and they can help you identify the research gap by helping you dissect the papers. So whatever paper you are interested in, you can get the help of dissecting it from the AI tool, using this AI tool. So references, when you cite evidence, and you need to know reference management. So there are multiple ways of managing references. There are multiple tools for reference management. So here I'm just going to tell you about what is in-text citation. Within the text, when you have a numbered style, that is called in-text citation. If you have author date style, that is also an in-text citation. Within the text, when you give a reference to the main complete reference, or you can give a clue or a link to that reference, that is the in-text citation that appears within the text, maybe in numbered style or in author date style. So what is the difference between in-text and end-text? End-text citation is given at the end. The last as with the heading of references or bibliography, where you can find in the numbered, if it's number 2, then you can find the detail in number 2. Okay, so in that way you can give a complete list of all the cited papers. What is the difference between references or bibliography? References are usually given at the end of the papers, or in it depends on the format of the university. The difference is that references include the list of papers, list of published evidence or unpublished evidence that is cited within the text. But bibliography includes all those published or unpublished evidence that are even not cited within the text. They are, but you use them while preparing for your paper. You read them. You have took an idea from them, so they must be cited at the end, but they are not available in the in-text. So bibliography, usually bibliography, it has more references at the end, but the in-text citations, they are less. So this is the difference between both. So there are multiple tools available. I will be sharing another video on EndNote, how to use it. And thank you so much. And we will be meeting in another video soon. Thank you.